Now, counseling or therapy for depression also works if done right. The type of counseling that most clinical psychologists do now is something called cognitive behavioral therapy. Now, this type of counseling, it's the one that really has been shown to work. And many of my patients are resistant to going into counseling because they think that they're going to be laying on a couch with the therapist stroking his goatee and taking notes as you free associate about your relationship with your mother. There's still some counselors that do that, but most of them have switched to this cognitive behavioral therapy. And what this is, briefly, is it's a form of psychotherapy that helps you modify your dysfunctional thought patterns, okay? To challenge your distorted cognitions that are contributing to your depression and anxiety, and change your thought patterns. So examples of dysfunctional thought patterns that cognitive behavioral therapy can help you with. People with depression and anxiety overwhelmingly focus on the negative aspects in their lives and kind of ignore the good things about their lives. Me, for example, if I see 25 patients in a day in my clinic and I'm able to help 23 of them, but 2 of them I'm not able to help or they leave upset with me, who do you think I think of when I go home at night? It's going to be those 2 people that I wasn't able to help. That's kind of dysfunctional thinking. People with depression and anxiety also tend to overgeneralize. For me, example, thinking, well, I wasn't able to help those 2 people today, so boy, I'm not helping anybody. Why do I even bother to go to work? That's overgeneralizing. Okay, we also might start catastrophizing. You make a small mistake at work and you think, okay, I'm going to lose my job. And you go to the bitter end. You say, I'm going to lose my job. My wife's not going to like me anymore. I'm going to lose my house, and everything's going to be miserable because I made this mistake at work. That's the thought. Those are kinds of thought process, dysfunctional thought process that cognitive behavioral therapy can help you with. So what cognitive behavioral therapy does is help you to recognize those dysfunctional thought patterns and replace them with more positive and more realistic thought patterns. And it has been shown to work. Now, if people were to ask me what is the best treatment for depression and anxiety, medication or cognitive behavioral therapy, head-to-head, probably they're about similar, actually. But the Cadillac treatment for depression and anxiety is probably both. Putting somebody with severe depression on a medication, but also getting them in to see a counselor. I have a lot of patients, like I said, that just don't have time to do the counseling and just want to try the medication. And I have a lot of patients that are just really averse to taking medication that really want to try counseling. The counseling is probably going to take a little bit longer, but I have no problem with people doing that. A couple of other practical things that I often tell my patients to do that have been shown to help with depression are, one is a gratitude journal. Writing down 3 times a week a few things that you're thankful for. People who do this, compared to people who don't do this, have been shown to have more sense of well-being and less depression. And it seems like an easy thing to do, almost too easy to work, but it's a simple thing that might help you with your depression. Another thing is giving service. A study a few years ago, I think 10, 15 years ago, they split student volunteers into 2 groups. One were told to serve the other group, to do nice things for the other group. At the end of the study, they measured which one of the group felt more happy. And the group that gave service felt more happy than the group who actually received service, which was interesting. And there is overwhelming evidence that people who regularly give service and charity are happier than those who don't. And so this is where getting involved in a church or community organizations where there are opportunities to give service is probably a good idea. It might help with your depression.